Well, you don't need to be a doctor of paediatrics to know that LGBTIQA plus gender fluid ideology is bad for children. But now the final review of Britain's child gender clinics by Dr. Hilary Cass has been released. There is now nowhere for Australian politicians to hide. Family First is watching the response of local MPs to the Cass report closely as it prepares for elections in Queensland, the ACT and federally. The Cass report is damning of LGBTIQA+ driven medical treatments of children. It says confused children have been let down by gender clinics which have prescribed puberty blockers, cross-sex hormones and even surgery. We've let them down because the research isn't good enough and we haven't got good data, Dr. Hilary Cass, the author of the report, said. Now, Britain's National Health Service, the NHS, has now banned the prescription of puberty blockers and cross-sex hormones on children because they can leave them permanently infertile and without sexual function. The Cass report released this week gave the background of how harmful puberty blockers became the go-to for LGBTIQA+ gender clinics around the world, including here in Australia. Dr. Cass wrote in her report, and I quote, "Based on a single Dutch study which suggested that puberty blockers may improve psychological well-being for a narrowly defined group of children with gender incongruence, the practice spread at pace to other countries. This was closely followed by a greater readiness to start masculising/feminising hormones in mid-teens and the extension of this approach to the wider group of adolescents who would not have met the inclusion criteria for the original Dutch study. Some practitioners abandoned normal clinical approaches to holistic assessment, which has meant that this group of young people have been exceptionalised compared to other young people with similarly complex presentations. They deserve much better." End quote. Now that's quite damning, and indeed they do deserve much better, as Hilary Cass has written. Clearly LGBTIQA+ ideology took over the medical treatment and psychological well-being of children. Cass told the BBC this week, and I quote again, "It is unusual for us to give a potentially life-changing treatment to young people and not know what happens to them in adulthood, and that's been a particular problem that we haven't had the follow-up into adulthood that we know the results of this are." End quote. Now, this is quite damning stuff, since back here in Australia, the Royal Melbourne Children's Hospital's its standard-setting child gender clinic continually asserts its medical practices on gender-confused children are just fine. Now, the release of the final Cass report prompted Australia's National Association of Practising Psychiatrists to come out with a statement very early and to urge the federal government to facilitate a national independent investigation into the use of treatments, including puberty blockers and cross-sex hormones, warning their use should be approached with caution. Now, the trouble with a cautious approach is it is likely illegal in most parts of Australia after foolish politicians in Queensland, the ACT, Victoria and now in New South Wales very recently passed so-called conversion therapy laws which make it illegal for doctors and counsellors to do anything other than affirm a child's gender confusion. It's very serious. In Victoria, the Liberals went to the last state election, get this, supporting Labor's so-called Change and Suppression Act, which has jail terms prescribed for parents. This is jail terms up to 10 years for a parent if they try and divert their child from the child gender clinics. That's if they try and do what Dr. Cass is saying and have a cautious approach. Now, politicians doing the bidding of LGBTIQA+ political activists has painted doctors, counsellors, religious organisations and parents into a legislative corner. Predictably, Equality Australia, the former leaders of the same-sex marriage Yes campaign, slammed the Cass report. Equality Australia's media release this week quoted Teddy Cook, who is a woman who has transitioned and identifies as a man and likes to pose in kink, as you can see on the screen. Now, Cook is one of these leaders of Equality Australia. Cook describes the prescription of puberty blockers to Australian children in this media release as part of a, quote, world-leading model of care. Now, that's not what the evidence is saying. Dr. Hilary Cass is not necessarily on the side of those of us who sit with the science of the gender binary, but she does appear to support the idea that gender is fluid. But, and get this is the important bit. While she might be ideologically on side with the LGBTIQA plus political movement, she at least has the honesty to acknowledge that the treatments for gender confusion lack evidence and are harmful. She warned that children were being used as a political football by both sides of the debate. Now, that's a fair comment. She went on to say, quote, the toxicity of the debate is perpetuated by adults, and that itself is unfair to the children who are caught in the middle of it. The children are being used as a football, and this is a group that we should be showing more compassion to, end quote. Now, I agree with that. I don't think we should use children as a football, and children that are struggling with their gender identity obviously deserve our deepest compassion and all the assistance and support that we can give them. But even Dr. Cass's research is showing that the pathway by LGBTIQA plus political activists in taking in this medicalised and surgical direction is harmful. Now, Family First and myself as someone who is a leader in the Family First political party does not seek a toxic debate nor to use children as political footballs. Let me make that very clear. But the challenge is the harm that is being done to children must continue to be called out. It is now up to Australian politicians to respond to what is yet more evidence of the harm of LGBTIQA plus gender fluid ideology. Sadly, Peter Dutton's Senate leader, Simon Birmingham, last year twice ran obstruction to initiatives to protect children from being harmed by child gender clinics. One of those initiatives was an inquiry called by Senator Pauline Hanson and the other by Liberal backbencher Senator Alex Antic. Birmingham and others from the Liberals' powerful left faction used their votes in the Senate to stymie public inquiries which would shine a light on how Australian children are being harmed. It's like Simon Birmingham voting against the Australian equivalent of a Hilary Cass review. How politicians like Birmingham respond to the evidence that Dr. Cass has now put forward will be watched very closely by the Family First political party as it prepares its campaigns for upcoming elections in Queensland, the ACT and federally. This is a time for politicians to step up, not to continue to hide behind the rainbow flag.